Hello and welcome. I'm Dr. Saab, a board-certified family physician licensed in all 50 states. In this video, I'll guide you through a clear, simple, and cost-effective approach to choosing the Medicare plan that's right for you. If you are approaching your 65th birthday or have recently become eligible for Medicare, you may find yourself standing at the entrance of what seems like a complicated maze. The path ahead is filled with terms like Part A, Part B, Part C, and Part D, not to mention supplement plans and advantage plans. This alphabet soup of healthcare options can feel overwhelming, creating a sense of confusion and anxiety right when you need clarity the most. It is completely normal to feel this way, as millions of Americans before you have faced the very same challenge of decoding this new system of health coverage. Rest assured, however, that this journey does not have to be a stressful one. The purpose of this guide is to act as your trusted map, breaking down each component of Medicare into simple, understandable pieces. We will walk through this process together, step by step, ensuring that every turn is clear and every choice is demystified. Think of this as a conversation where we translate the complex language of insurance into plain English. My goal is to empower you with the knowledge and confidence you need to navigate this new landscape, transforming what seems like a daunting task into a manageable series of informed decisions that serve your best interests. By the time you finish reading, you will have a solid understanding of how Medicare works and what your options truly are. You will learn the fundamental differences between staying with original Medicare and choosing a Medicare Advantage plan. We will explore the specifics of what each part covers, what it costs, and how to fill in any potential gaps in your coverage to protect your health and your finances. The aim is not just to provide information, but to equip you with a practical framework for evaluating your personal needs, your lifestyle, and your budget against the plans available to you. Ultimately, this guide is designed to lead you to a single crucial outcome, selecting the Medicare plan that is genuinely right for you. There is no one-size-fits-all answer, as the best choice depends entirely on your unique circumstances, from the doctors you see to the medications you take. We will untangle the maze together, ensuring that you feel secure and prepared to make a decision that provides peace of mind for the years ahead. The path to comprehensive healthcare coverage is right in front of you, and with a little guidance, you will be able to walk it with certainty. Let us begin this important journey together. At its core, Medicare is a federal health insurance program designed to provide reliable medical coverage for a specific group of Americans. It is primarily intended for individuals who are 65 years of age or older. However, eligibility is not limited solely by age. Certain younger people who have specific disabilities, such as end-stage renal disease or amyotrophic lateral sclerosis, may also qualify for Medicare benefits long before they reach their 65th birthday. This program was established to ensure that seniors and qualifying individuals with disabilities have access to affordable health care, helping to cover the costs of necessary medical services and treatments as they navigate their later years or manage chronic conditions. Understanding the basic structure of Medicare is the first step toward making an informed decision. The program is fundamentally broken down into 4 distinct parts, each identified by a letter of the alphabet. Part A is your hospital insurance, which helps pay for inpatient care you receive in a hospital or a skilled nursing facility. Part B is your medical insurance, covering a wide range of services like doctor visits, outpatient care, and preventive screenings. Together, Part A and Part B are often referred to as Original Medicare. Then there is Part D, which is dedicated specifically to covering the costs of prescription drugs. These 3 parts can be thought of as the foundational building blocks of your coverage. The 4th component, Part C, offers a different way to receive your Medicare benefits. Known as Medicare Advantage, Part C plans are offered by private insurance companies that are approved by Medicare. These plans are required to provide, at a minimum, the same level of coverage as Original Medicare, Parts A and B. However, they often bundle this coverage together with other benefits, such as prescription drug coverage, into a single, all-in-one package. This creates a fundamental choice for every new enrollee. You can either start with the government-administered Original Medicare and add pieces to it, or you can opt for a privately run, consolidated Medicare Advantage plan from the outset. It is crucial to grasp this foundational concept because every other decision you make will stem from it. The path you choose will influence which doctors you can see, how much you pay for services, and what extra benefits you might receive. Think of it as deciding between buying a home and customizing it to your liking versus buying a home that comes fully furnished and decorated. Both options can lead to a wonderful outcome, but they represent very different approaches to achieving your goal. Our next step is to explore these 2 primary paths in greater detail, so you can determine which one aligns best with your personal health needs and financial circumstances. When you enroll in Medicare, you face a significant decision that shapes your entire healthcare experience. You must choose between 2 primary structures for receiving your benefits. The first option is to stay with Original Medicare, which consists of Part A, hospital insurance, and Part B, medical insurance. This is the traditional government-administered program. If you select this path, you will likely need to supplement your coverage, as original Medicare does not pay for everything. You typically do this by purchasing a separate Part D plan for your prescription medications and, quite often, a Medicare supplement insurance plan, also known as a Medigap policy, to help cover out-of-pocket costs. This first path offers a great deal of freedom and flexibility. With original Medicare, you have the ability to see any doctor or visit any hospital in the United States that accepts Medicare patients. There are no restrictive provider networks to worry about, which can be a major advantage if you travel frequently or want to see specific specialists without needing a referral. By adding a Medigap plan, you can significantly reduce your financial uncertainty by covering costs like deductibles and coinsurance. This combination, original Medicare, a Part D plan, and a Medigap policy, is often chosen by individuals who prioritize predictability in their healthcare costs and want the broadest possible access to providers nationwide. The second path you can take is to enroll in a Medicare Advantage plan, also known as Part C. This is an alternative way to receive your Medicare benefits offered through private insurance companies that have a contract with the federal government. These plans bundle your Part A and Part B coverage into a single comprehensive plan. Most Medicare Advantage plans also include prescription drug coverage, eliminating the need to buy a separate policy. Furthermore, many of these plans offer attractive extra benefits not covered by original Medicare, such as routine dental, vision, and hearing care, as well as fitness program memberships like Silver Sneakers. This all-in-one approach is designed for convenience and often comes with lower monthly premiums, sometimes even a $0 premium beyond what you already pay for Part B. However, this path typically involves more restrictions. Medicare Advantage plans usually operate with local or regional provider networks, meaning you must use doctors and hospitals within that network to receive the lowest costs. You may also need to get prior authorization for certain services or referrals to see specialists. The second path is often favored by individuals who are comfortable with managed care networks, appreciate the simplicity of a single plan, and are drawn to the additional benefits and potentially lower monthly costs. Original Medicare is the foundation of the federal health insurance program, and it begins with Part A, which is your hospital insurance. This part is designed to cover the significant costs associated with inpatient care. This includes services you receive when you are formally admitted to a hospital or skilled nursing facility by a doctor's order. For example, if you have surgery that requires you to stay overnight, Part A helps pay for your semi-private room, meals, nursing services, and any drugs as part of your inpatient treatment. It also extends to care in a skilled nursing facility, but only after a qualifying hospital stay and for a limited time to help with your recovery. The coverage provided by Part A also includes hospice care for individuals who are terminally ill, focusing on comfort and quality of life rather than curative treatments. This benefit is comprehensive, covering pain relief, symptom management, and support services for both the patient and their family. In some specific circumstances, Part A may also cover certain home healthcare services if you are deemed homebound and require skilled nursing care. It is important to understand that Part A is not for long-term custodial care such as help with daily activities like bathing or dressing, but rather for medically necessary short-term, inpatient services that are part of a specific treatment plan. For the vast majority of people, Part A comes at no monthly cost. This is because you or your spouse have likely already paid for it through Medicare taxes, deducted from your paychecks over your working years. If you have at least 10 years or 40 quarters of paying Medicare taxes, you will be automatically entitled to premium-free Part A. However, even with premium-free coverage, Part A is not entirely free when you use it. There are out-of-pocket costs. You are responsible for most notably a significant deductible for each hospital benefit period. As of 2024, this deductible is $1,632, and you must pay it before Medicare starts covering its share. A benefit period is a unique concept in Medicare that you need to grasp. It begins the day you are admitted as an inpatient and ends when you have not received any inpatient hospital or skilled nursing facility care for 60 consecutive days. This means that if you are readmitted to the hospital after being out for more than 60 days, a new benefit period starts, and you would have to pay the Part A deductible again. Understanding these costs and how a benefit period works is essential for managing your healthcare expenses and recognizing the potential gaps that original Medicare alone does not cover, which we will discuss later. While Part A covers your inpatient hospital care, Part B is the other half of original Medicare, providing your medical insurance for outpatient services and supplies. This is the part you'll use most frequently for your routine healthcare needs. It covers doctor visits, primary care physician checkups, and specialist visits. It also pays for outpatient hospital care like emergency room services or outpatient surgery centers. If it's medically necessary outside hospital admission, it's probably covered by Part B. The scope of Part B coverage is quite broad and includes many preventive services to keep you healthy and detect problems early. These services include flu shots, cancer screenings like mammograms, and wellness visits. Part B helps pay for durable medical equipment such as walkers, wheelchairs, and oxygen tanks when prescribed by your doctor. It also covers ambulance services, clinical research, mental health services, and getting a second opinion before surgery. This comprehensive coverage ensures access to day-to-day medical care outside hospitals. Unlike premium-free Part A, Part B requires a monthly premium. In 2024, the standard monthly premium is $174.70, although this can be higher for greater incomes. This premium is deducted from Social Security or billed quarterly if not receiving benefits. Part B also has an annual deductible, which is $240 in 2024. You must pay this out of pocket before Medicare begins paying its share. Once you've met your annual deductible, Original Medicare doesn't cover 100% of bills. For most Part B services, you're responsible for 20% coinsurance. After your deductible is paid, Medicare pays 80% of approved amounts, and you pay the remaining 20%. There's no annual limit on this coinsurance, meaning your out-of-pocket costs could be substantial if you require extensive medical care. This financial exposure is why many people supplement Original Medicare. Original Medicare doesn't cover most prescription drugs you pick up at the pharmacy. Part A covers drugs during hospital stays, and Part B covers a few outpatient drugs, but your regular prescriptions aren't included. This leaves a major gap. Medication costs can be unpredictable and high. To protect yourself, you need a Medicare Part D prescription drug plan. Even if you don't take medications now, enrolling in Part D when you're first eligible avoids future penalties and ensures you're covered if your needs change. Most Medicare Advantage plans include drug coverage, but if you stick with Original Medicare, you'll need a standalone Part D plan. Without Part D, you could face huge out-of-pocket costs for medications. Prescription drug coverage is essential for every Medicare beneficiary, not just those who are currently ill. Not all Part D plans are the same. Choosing the right one takes research. Use the Medicare Plan Finder at medicare.gov to compare plans based on your medications and preferred pharmacy. Check each plan's formulary to make sure your drugs are covered, and note the cost tiers for generics versus brand name drugs. Make sure your pharmacy is in network for the best prices. Compare total annual costs, not just monthly premiums. Sometimes a higher premium means lower drug costs overall. Consider deductibles, copayments, and coinsurance for your specific prescriptions. Take your time, review the details, and balance costs with coverage. The right Part D plan protects your health and your wallet. Even with Parts A and B, you're still responsible for significant out-of-pocket costs. There's no annual limit. Medigap, or Medicare Supplement Insurance, fills these gaps by covering deductibles, copayments, and coinsurance. Medigap plans are standardized by the government, so benefits for each lettered plan are the same no matter the insurer, only the price varies. With Medigap, you pay a predictable monthly premium and keep the freedom to see any Medicare accepting provider nationwide. Medigap works alongside Original Medicare. Medicare pays first, then your Medigap plan covers its share. You can't have both Medigap and Medicare Advantage. You must choose one path. If you want broad provider choice and predictable costs, Medigap plus Original Medicare is a strong option. It's about turning unpredictable expenses into manageable fixed payments. Medigap plans are labeled A through N, each offering different coverage levels. For new enrollees, Plan G is the most comprehensive, covering nearly all out-of-pocket costs except the Part B deductible. Plan N offers lower premiums but includes small copayments for doctor and ER visits. Premiums vary by age, location, and other factors, so shop around for the best price. Benefits are standardized. The best time to buy is during your 6-month Medigap Open Enrollment period, when you can't be denied coverage or charged more for pre-existing conditions. Plan F and C are no longer available to new enrollees, so focus on G and N. Choose the plan that matches your health needs and budget. Medigap provides peace of mind and financial protection. Medicare Advantage, or Part C, is the main alternative to Original Medicare. These private plans bundle hospital, medical, and usually prescription drug coverage into one package. You're still in Medicare, but your benefits are managed by a private insurer. Most plans operate as HMOs or PPOs, using provider networks to keep costs down. Medicare Advantage plans must cover everything Original Medicare does, plus often include extra benefits. You trade nationwide provider freedom for lower costs and added perks. It's a good fit if you want simplicity, extra benefits, and are comfortable with a provider network. Next, we'll look at the specific advantages and potential drawbacks of this path. Medicare Advantage plans offer convenience. One card, one company, and often one low monthly premium. Many plans include prescription drugs, dental, vision, hearing, and wellness perks like gym memberships. Extra benefits can save you hundreds or thousands compared to paying out of pocket. Every plan has an annual out-of-pocket maximum, capping your costs for covered services. Original Medicare doesn't. For 2024, this cap is $8,850 for a network care. After that, the plan pays 100%. Some plans offer over-the-counter allowances, transportation, or meal delivery after hospital stays. Medicare Advantage is designed for those who value simplicity, extra benefits, and financial protection. It's a holistic, convenient option for many Medicare beneficiaries. While the benefits of Medicare Advantage plans are clear, it is equally important to understand the potential drawbacks and limitations. The most significant trade-off is the requirement to use a provider network. Most plans are either HMOs or PPOs, which means you will have a specific list of doctors, specialists, and hospitals that you must use to get the lowest costs. If you go outside the plan's network, your costs could be much higher, or the service may not be covered at all, except in an emergency. This can be a major disadvantage if you have long-standing relationships with doctors who are not in the plan's network, or if you travel frequently and need care in different parts of the country. Another potential frustration for some members is the need for prior authorization for certain medical services, tests, or procedures. This means that before you can receive a specific treatment, your doctor must get approval from the insurance company to confirm that it is medically necessary. This process can sometimes cause delays in receiving care and can feel like an intrusive barrier between you and your doctor. Similarly, many HMO plans require you to get a referral from your primary care physician before you can see a specialist. This extra step can be cumbersome for those who need to see multiple specialists regularly. The costs associated with Medicare Advantage plans can also be more complex than they first appear. While the monthly premiums are often low or even zero, you will have co-payments and coinsurance for nearly every service you use, from doctor visits to hospital stays. These costs can add up quickly if you need frequent medical care. It is crucial to look beyond the premium and carefully review the plan's summary of benefits to understand what you will pay for different services. The out-of-pocket maximum provides a safety net, but reaching that limit, which can be thousands of dollars, can still represent a significant financial burden for many individuals. Finally, it is important to remember that these plans are offered by private companies and their details can change every year. The provider network, formulary, premiums, and co-payments can all be adjusted annually. This means you must review your plan each year during the annual enrollment period to ensure it still meets your needs. The plan that is perfect for you this year might not be the best fit next year if your doctor leaves the network or your medications are no longer covered favorably. This lack of long-term stability requires you to be a more active and engaged healthcare consumer than you might be with the more stable original Medicare and Medigap combination. Deciding on your Medicare path is a deeply personal choice that hinges on your priorities for healthcare, your financial situation, and your lifestyle. Let's first consider the path of original Medicare supplemented with a Medigap policy and a separate Part D prescription drug plan. This route is often the preferred choice for individuals who place the highest value on freedom of choice and predictability of costs. If your top priority is to see any doctor or visit any hospital in the United States that accepts Medicare without worrying about network restrictions, this path offers unparalleled flexibility. It ensures you have access to specialists nationwide without needing a referral from a primary care physician. This combination is also ideal if you have complex health needs or see specialists frequently. The seamless coordination between original Medicare and a comprehensive Medigap plan, like Plan G, simplifies your financial obligations significantly. After meeting your small annual Part B deductible, you can have peace of mind knowing that nearly all of your Medicare-approved costs will be covered. This creates a very predictable budget, where your primary healthcare expenses are your fixed monthly premiums for Part B, your Medigap plan, and your Part D plan. For those who want to avoid surprise bills and the stress of paying copays for every visit, this predictability is a major advantage. Furthermore, this path is often the best fit for people who travel extensively within the United States, whether visiting family, enjoying a snowbird lifestyle, or exploring the country in an RV. Since your coverage is not tied to a local or regional network, you can receive care wherever your travels take you as long as the provider accepts Medicare. This freedom from network constraints provides a critical layer of security and convenience when you are away from home. The peace of mind that comes from knowing you are covered for medical emergencies or routine care anywhere in the nation is a significant factor for many retirees who lead an active and mobile lifestyle. Ultimately, you should choose the original Medicare path if you are willing and able to pay higher monthly premiums in exchange for maximum flexibility and near total cost certainty. This route is for the person who says, I want to know that if I get sick, my costs are covered and I can go to the doctor of my choice without asking for permission. It is a decision that prioritizes comprehensive coverage and autonomy over the lower upfront costs and bundled extras of an alternative plan. If this sense of security and control aligns with your personal philosophy on healthcare, then this is likely the right Medicare path for you. Now let's explore the second major path, choosing a Medicare Advantage, or Part C, plan. This all-in-one alternative is designed for a different set of priorities focusing on convenience, lower monthly costs, and valuable extra benefits. You should seriously consider a Medicare Advantage plan if your primary goal is to keep your fixed monthly expenses as low as possible, with many plans offering a $0 monthly premium, beyond what you already pay for Part B. This route can be very attractive for those on a tight or fixed income. The trade-off for these lower premiums is that you will have co-payments and coinsurance when you access care, but the costs are managed within a network. This path is also an excellent fit if you appreciate the simplicity of a single bundled plan. Managing just one card for your medical, hospital, and prescription drug needs can feel much more straightforward than juggling original Medicare, a Medigap policy, and a Part D plan. If you are comfortable with the concept of a provider network and have confirmed that your preferred doctors and hospitals are included, the network restrictions may not be a significant drawback for you. For individuals who do not travel much and receive most of their care locally, staying within a regional network is often very manageable and a worthwhile compromise for the plan's other benefits. The rich array of extra benefits is another powerful reason to choose this path. If you anticipate needing dental, vision, or hearing care, a Medicare Advantage plan that includes these services can save you a substantial amount of money. The inclusion of perks like gym memberships, over-the-counter allowances, and transportation services can also enhance your overall wellness and quality of life. If you see healthcare as a holistic package and are excited by the idea of getting these additional benefits without having to purchase separate insurance policies, then the value proposition of a Medicare Advantage plan will be very appealing to your needs. In summary, you should choose the Medicare Advantage path if you want lower monthly premiums, value the convenience of an all-in-one plan, and are happy to receive your care from a network of providers. This option is best for the budget-conscious individual who likes the idea of extra perks and is protected by the annual out-of-pocket maximum. In a worst-case scenario, it requires you to be a more engaged consumer, checking each year that the plan's network and benefits still align with your needs. If this sounds like a reasonable trade-off for lower upfront costs and more comprehensive benefits, then a Medicare Advantage plan is likely your ideal choice. Understanding when to enroll in Medicare is just as important as choosing the right plan. Missing your enrollment window can lead to gaps in coverage and even lifetime penalties, so it is crucial to be aware of the key deadlines. For most people, the first opportunity to sign up is during their initial enrollment period, or IEP. This is a specific 7-month window that is centered around your 65th birthday. It begins 3 months before the month you turn 65, includes your birthday month, and extends for 3 months after your birthday month. Signing up during this period ensures your coverage starts in a timely manner and helps you avoid any late enrollment penalties. It is highly recommended to enroll during the first 3 months of your IEP before your birthday month. If you do so, your Medicare coverage will start on the first day of the month you turn 65, providing seamless protection from day one. If you wait to enroll during your birthday month or in the 3 months that follow, your coverage start date will be delayed. This could leave you without health insurance for a period of time, which is a risky situation to be in. Therefore, acting early within your initial enrollment period is the safest and most effective strategy to ensure there are no gaps in your healthcare coverage as you transition into Medicare. When you are ready to enroll, you have several convenient options for submitting your application. The easiest and fastest method for most people is to enroll online through the official Social Security website at saa.gov. The online application is straightforward and can be completed in as little as 10 minutes. It requires no documentation and allows you to sign up for Medicare Part A and Part B. This is the most efficient way to get the process started from the comfort of your own home without needing to visit an office or wait on the phone for assistance with your application. If you prefer not to use the online portal, you can also enroll by calling Social Security directly. Their representatives can help you complete your application over the phone. The toll-free number is 1-800-772-1213, and TTY users can call 1-800-325-0778. Alternatively, you can make an appointment to apply in person at your local Social Security office. Finally, if you need personalized guidance in choosing your specific plans, such as a Part D or Medigap plan, you can work with a licensed insurance agent who specializes in Medicare. They can help you navigate your choices and assist with the enrollment process, often at no cost to you. We have now traveled together through the entire landscape of Medicare, from the foundational Parts A and B to the supplemental choices of Part D and Medigap, and on to the all-in-one alternative of Medicare Advantage. The journey that may have seemed like navigating a confusing maze at the beginning should now feel like a well-marked path. By breaking down each component step by step, the alphabet soups of healthcare has hopefully become a clear menu of options. Medicare, in all its complexity, is ultimately designed to provide you with reliable health coverage, and understanding its structure is the key to unlocking its full potential for your well-being. The most important takeaway from this guide is that there is no single best Medicare plan for everyone. The right choice is deeply personal and depends entirely on what you value most. It is a balance between your specific health needs, your financial budget, your lifestyle, and your desire for either flexibility or convenience. Whether you choose the broad freedom and predictable costs of original Medicare with a Medigap supplement or the low premium, benefit-rich structure of a Medicare Advantage plan, the power to select the coverage that fits your life is firmly in your hands. This decision is one of the most important you will make for your retirement years. As you move forward to make your selection during your initial enrollment period, remember the checklists we discussed list, your doctors to check network compatibility list, your medication to compare drug plan formularies, and consider your travel habits. Most importantly, compare the total potential costs of each path, not just the monthly premiums. Taking the time to do this research now will pay dividends in the form of financial security and peace of mind for years to come. Your health is your most valuable asset, and choosing the right insurance to protect it is a profound act of self-care and responsible planning. Finally, please remember that you are not alone in this process. If you still have questions or feel uncertain about which path to take, do not hesitate to seek help. You can use the official resources at Medicare.gov, speak with a representative from the State Health Insurance Assistance Program or SHIP, or consult with a trusted independent insurance agent who specializes in Medicare. Your goal is to make a confident, informed decision. Medicare does not have to be a source of stress. With the right information and support, it can be the foundation of a healthy, secure, and vibrant future.